If you're a senior or caring for one, hearing loss might be something you've been dreading. Hearing loss is common among seniors, but it doesn't have to be a major disruption to your life. In this video, we'll talk about what kind of hearing loss to expect as you age and how to adapt. Stay tuned. Welcome back to our channel, where we provide helpful advice and resources for seniors and their loved ones. If you're new here, don't forget to hit the subscribe button below and turn on notifications so you never miss an update. There are several types of hearing loss, and it can happen for many reasons. The most common cause of hearing loss as we age is noise-induced hearing loss. Over time, exposure to loud noises can damage the tiny hair cells in our ears that help us detect sound. This can happen from prolonged exposure to noise at work or from enjoying activities like concerts or sporting events. Other causes include genetics, head or neck injuries, certain diseases, and some medications. While age-related hearing loss is common, it's not normal. Hearing loss can make everyday tasks more challenging. You might struggle to hear the doorbell when someone asks at the door or have difficulty following conversations with friends. Even missing important announcements on TV or radio can become frustrating. Fortunately, there are ways to combat these challenges and still enjoy life to the fullest. First, let's discuss the different types of hearing loss. We'll start with sensorineural hearing loss, which occurs when there's damage to the inner ear or the nerve connecting the ear to the brain. As we mentioned before, this type of hearing loss is often caused by exposure to loud noises, genetics, or aging. Sensorineural hearing loss can result in difficulty understanding speech, especially in noisy environments. You might also experience a loss of balance and dizziness. The second type of hearing loss we'll discuss is conductive hearing loss. This happens when there is a problem with the outer or middle ear that prevents sound waves from reaching the eardrum or getting through to the inner ear. It could be due to earwax buildup, fluid in the middle ear, or an ear infection. Conductive hearing loss typically makes it harder to hear sounds at all, but you should still be able to hear speech fairly well. Finally, we'll discuss mixed hearing loss, which is a combination of both sensorineural and conductive hearing loss. This type of hearing loss can make it difficult to hear sounds and understand speech. It's important to identify the underlying cause of the hearing loss in order to develop the best treatment plan. Now that you know more about the different types of hearing loss, let's talk about what to expect as you age. As we get older, our hearing naturally deteriorates, making it harder to hear high-pitched sounds like the voices of women and children. This type of hearing loss is known as presbycusis, and it affects about 2/3 of people over 70. The good news is that presbycusis is usually gradual and can be managed with the right support. Another thing to expect is that you may start to notice background noises more than before. This can be especially true in quiet rooms where you might hear sounds like the hum of the refrigerator or the beep of the oven. Background noise can make it difficult to focus on a conversation, so it's important to find ways to minimize distractions. You might also find that you're mishearing sounds, which can lead to misunderstandings in conversations. For example, you might hear the word cat when someone says hat. This type of mishearing is called phonemic paraphasia, and it's common in people with hearing loss. To avoid misunderstandings, it's helpful to let others know that you're having trouble hearing and ask them to repeat themselves if you didn't catch what they said. It's important to remember that everyone experiences hearing loss differently. Some people may lose their hearing gradually over time, while others may lose their hearing more quickly. There are also variations in the type and severity of hearing loss. Some people may struggle to hear high-pitched sounds, while others may have trouble understanding speech in noisy environments. It's important to work with audiologists to identify the specific challenges you're facing so they can recommend the best course of action. Now that you know what to expect, let's discuss some tips for adapting to hearing loss. The first step is to visit an audiologist and get your hearing checked. An audiologist is a specialist who tests hearing and provides treatment for hearing loss. They'll perform a hearing test to measure the severity of your hearing loss and help you identify the sounds you're having trouble hearing. Depending on the results of your hearing test, the audiologist may also perform other tests to determine the underlying cause of your hearing loss. Once you know the extent of your hearing loss, the audiologist may recommend a few options for treatment. If your hearing loss is mild to moderate, they may suggest using hearing aids to amplify sounds and make them easier to hear. Hearing aids come in various styles and sizes, so it's important to find ones that fit comfortably and work well for you. Another option for treating hearing loss is cochlear implants. Unlike hearing aids, which sit outside the ear and amplify sound, cochlear implants are surgically implanted devices that stimulate the auditory nerve directly. Cochlear implants are usually reserved for people with severe hearing loss who aren't helped by hearing aids. In addition to these medical treatments, there are also assistive listening devices that can help you hear better in certain situations. For example, personal amplifiers can make it easier to hear in noisy places like restaurants. Meanwhile, captioned telephones and visual alert systems can help you communicate with family and friends. Assistive listening devices aren't a substitute for hearing aids or cochlear implants, but they can be useful in certain situations. As you explore your treatment options, don't hesitate to ask questions and learn everything you can about hearing loss and its potential impact on your life. It's also important to try out different treatment options to find what works best for you and your lifestyle. Another helpful tip for seniors experiencing hearing loss is to stay socially connected. It can be easy to withdraw from social situations when you're struggling to hear, but it's important to keep up with friends and loved ones. Staying socially connected can help you maintain your mental and emotional well-being. So find ways to connect with others that work for you, whether it's through phone calls, video chats, or in-person visits. To make conversations easier, try using a quiet place with minimal distractions. Face the person you're speaking with, and use a moderate pace when talking. You can also repeat important information to ensure understanding. Remember, it's okay to take breaks during conversations if you become fatigued. And don't be afraid to ask others to repeat themselves if you don't understand what they're saying. These tips can help make conversations more successful and enjoyable for everyone involved. Finally, don't forget to take care of your overall health. Hearing loss can be frustrating and challenging, but it's important to remember that you're not alone. Reach out to friends, family, and healthcare professionals for support and understanding. They can provide emotional support and practical assistance as you navigate the challenges of hearing loss. Don't be afraid to ask for help. Whether it's running errands, attending appointments, or simply lending an ear, your support system can make a world of difference. Together, you can overcome the challenges of hearing loss and continue to enjoy life to the fullest. Hearing loss is a common challenge for seniors, but it doesn't have to be a major disruption to your life. By understanding the different types of hearing loss and taking steps to address it, you can continue to enjoy your golden years. Remember to schedule regular hearing checkups, explore treatment options, stay socially connected, and take care of your overall health. With the right mindset and support, you can adapt to hearing loss and keep living life to the fullest. Thank you for watching today's video. We hope you found it helpful and informative. If you have any questions or comments, please feel free to leave them below. We love hearing from you. And if you haven't already, please don't forget to hit the subscribe button so you never miss an update. We look forward to seeing you in our next video.